Welcome to TCM Classics. Today I'm going to be showing you a few needles on the hands and forearms, 3 of which are special points, which I will be making an in-depth video on later this week, so make sure to check that out on my YouTube channel. Inserting Lu10, which is not a special point first, and it is on the palm on the radial side of the midpoint of the first metacarpal bone at the junction of the red and white skin. So I am just swiping with 70% isopropyl alcohol first on all the points I'm going to be inserting, and you can see me measuring the midpoint of the first metacarpal bone and at the junction of the red and white skin. I am taking the needles out immediately after or a few seconds after so that I can keep demonstrating. And this point is fantastic. It's a fantastic point for all sorts of lung conditions. It sort of dredges the lung meridian, as it is the second last point on that meridian. And it is great for cough, hemoptysis, sore throat, loss of voice, feverish sensation of the palm. And it is great for moxibustion, can be used on it as well. And venules of the thumb draining to the cephalic vein is something to be aware of when needling this point. The second point that I'm going to be showing you is actually a special point. It's called Zhong, and it is located on the lateral aspect of the forearm, midway between the transverse wrist crease and the elbow crease between the radius and ulna. And it is a fantastic point for paralysis, spasm, contracture of the upper extremities, pain of the forearm, and from a Western medical point of view, it is indicated for hemiplegia of the upper limb, spasms of the upper limb, neuralgia of the forearm, and hysteria. It is also called arm central. The next point that I am going to be needling today is called R-bi, or 2 whites, and it is also an extra point. And I should state that an extra point is not the same thing as a special point. All the points that I'm showing you today outside of Lu10 are extra points. And once again, I will make an in-depth video on extraordinary meridians, extra points, and special points. There's so many points, but I promise I will cover everything. So as I mentioned, R-bi, or 2 whites, is the point I'm needling here, and it is on the flexor aspect of the forearm, 4 chin proximal to pericardium 7, and it's on either side of the tendon of flexor carpi radialis. And as you can see, R-bi are 2 points, and one lies on the ulnar side of the tendon of flexor carpi radialis and between this and the tendon of the palmaris longus if it's present, while the other lies on the radial side of the tendon of the flexor carpi radialis. And R-bi is indicated for hemorrhoids and prolapse of the rectum. It treats prolapse of the rectum, hemorrhoids, itching of the anus, blood in the stool, and tenesmus. And it is very important to note that all of the extra points are kind of, not all of them, but most of them are like this, where unlike the points that are located along the meridian lines in the body and have a number system, they and Du and Ren, they don't have that, and they have an indication that is quite specific. So for instance, when it comes to R-bi, we think hemorrhoids, prolapsed rectum. Here I am needling a point that is an extra point called Lu10, and it actually means stiff neck, so you can assume that that is what it is indicated for, and it works to invigorate qi and blood in the neck region, treating stiffness and pain of the neck, inability to turn the head, headache, pain of the shoulder and arm, pain of the epigastrium, diarrhea, acute and chronic childhood fright, and wind. And lastly, today I'm needling Tong Shui, or lumbar pain point. And it is a point located on the dorsum of the hand, as you can see, and it's 2 points between the 2nd and 3rd and the 4th and 5th metacarpal bones. So one in the same line between the 1st and 2nd as Lu10, and then the other one between the 4th and 5th metacarpal bones, and the depressions lying immediately distal to the bases of the metacarpals. And Tong Shui invigorates qi and blood in the lumbar region, treating acute lumbar sprain. So today we learned Yuji, Lu10, R-bi, Zhong, Tong Shui, and Lu10. I hope you have a wonderful rest of your day. And stay tuned for a few new facial acupuncture videos coming tonight, as well as a few new body acupuncture videos and Jingui Yao Lui, as well as Zhong Fu and Extraordinary Meridians later next week. And if you would be so kind to subscribe to my YouTube channel, that would be greatly appreciated. I am looking to try to be eligible to earn. I am keeping my page free, and you don't have to like any of my videos. Just if you could subscribe, that would be so greatly appreciated. I hope you have a wonderful rest of your weekend, and happy Chinese New Year.